In this video, we will discuss body weight-based orders for continuous IV medications. A lot of times these look like things like ordered at 5 micrograms per kilogram per minute. And so the medication is ordered to go continuously. It'll be either every minute, sometimes it's per hour, depending on the type of medication. It could be milligrams per kilogram per hour. So the orders can vary somewhat, but the key here is that we are focusing on calculations that have this body weight component to them. So the prescriber is ordering something related to that patient's specific kilograms. How much do they weigh? And that will determine then, okay, this patient weighs so many kilograms, they get 5 micrograms for every kilogram that they weigh, and that's per minute. Sometimes it's per hour. You'll have to look carefully and see the variations in the orders. When we look at these sort of calculations, there are some key elements and steps that you'll want to approach these calculations with. The first thing I always like to consider is the patient's actual body weight. So I'll draw a little stick figure here to represent that. That's how much the patient weighs. Now, if it's not already listed in kilograms, you'll need to convert it to kilograms. So you can watch my video on how to convert pounds to kilograms if that is something you do not know how to do. I'm going to make the assumption in this video that you are starting with kilograms or that the patient already has a charted weight in kilograms. So kilograms is the first thing you want to look at. You will use how many kilograms that patient weighs to calculate the order for this patient and in a specific order based on their body weight. This will be a dose over a certain amount of time. It could be micrograms per minute, it could be milligrams per hour, but you will get a dose per time. Then the next thing you'll want to consider is the time. Does the time need to go from minutes to hours, or is it already in hours? You may or may not need to do a time conversion. The other thing to consider is, do you need to do a unit conversion? You may or may not need to do a unit conversion. The medication order in the dose over here, this needs to match what's in the IV bag. So you might need a unit conversion then. You might not. And I'll show you an example of all this. And then you use the IV med that is available. So once you have your kind of basic steps written out, again, let me review them in order and I'll highlight these so you can remember them. We're going to start first with the patient's weight in kilograms. All right, that's number one. Then you got to make sure that you got your order written out. This is the first kind of step of your dimensional analysis. You can also take these conversions step by step. You do your order, then your time, then your units, and then your IV medication available. You may not need time. You may not need units. You have to determine that every step along the way if that's necessary for this calculation. And I'll demonstrate this as we move forward. The key is that when you end your equation, you are always looking for an answer in milliliters per hour. You want your answer to be milliliters per hour because that's what you'll always program your IV pumps with. So the whole goal of this is to be able to give the patient the medication at the proper and safe rate based on the order. So you'll need to find the milliliters per hour. Let's move ahead and we will start with an example and try to implement this. Our question is, we need to administer an order for dobutamine at 5 micrograms per kilogram per minute. That's our weight-based order right there. We know the patient weighs 70 kilograms because it says that right there, and the available medication concentration is 250 milligrams per 250 milliliters. So first things first, we always identify our order, right? We've always done that. Let's circle or underline that order right now. So you'll always want to identify your order. This is a weight-based order, so we know first things first, if you ever see that kilogram in there, know you have to address the kilograms. So how I like to do that is I like to take my patient's body weight, which I also see is right here, 70 kilograms, and I just multiply that by the weight-based order, which is 5 micrograms per kilogram per minute. So this is always the first step when you see that weight in there. All right, when you do this multiplication step, you're going to see that the units can cancel. So kilograms will cancel kilograms, and you'll be left with the micrograms per minute for this patient. So let's do that right away. Let's do 70 times 5. We get 350, and I always recommend you keep the labels in there. So that's micrograms per minute. You can write that up and down like a fraction or just like a slash here, but just understand it's micrograms on the top and minutes on the bottom. This is now your specific order for this patient, but we need to find the rate in milliliters per hour as this question is asking for. So this is where I like to start with writing my order out a little bit differently, and I kind of put it down in a different area. I know this patient needs to get 350 micrograms per minute. As I've said before, you can do this step by step, or you can do it in the traditional dimensional analysis way where you just line it up and do all your conversions on your calculator at one time once you have your equation written out. Or you, like I said, you can do it step by step. It's up to you and whatever you like to do best. As we mentioned before, our first step was to identify the body weight and take care of that. Now we have our order. So we have our order. Let's look at the time first. We know we're trying to go to milliliters per hour. This is where we're trying to figure out for this patient. And if we look at the bottom here, we're trying to go from minutes to hours. All right, that's where we're trying to head. So in order to do that, we have to use a time conversion. And I will try to keep that in the same color by writing it in purple. So here we go. Time conversion. I'm just labeling these for you. But you're going to want to take minutes to hours. And hopefully you remember how to do these sort of conversions. We know that 1 hour is always equal to 60 minutes. So our conversion factor is always equal. The top should equal the bottom should equal the top, right? We put it on the top here because we want minutes to cancel here with minutes on the bottom here. So that's our first step. Now we know the bottom is going to be in hours once we do that math. Our second step is to look at units. Do we need a unit conversion? Well, let's see here. We have micrograms listed up here in our order, all right? And we are trying to use the IV bag, which is listed up here, and that is milligrams. So we do need to go from micrograms to milligrams. And we know we put micrograms on the bottom because, again, it's on the top in our order over here. Now, if you remember your conversion factor, you know that 1 milligram equals 1,000 micrograms. Again, you can do this in a different order, but you do need to identify a time conversion. You do need to identify a unit conversion because we've got to have it in micrograms or milligrams. Micrograms cancels with the micrograms here, and this will be converted to milligrams once that math is complete. And then our final step right now, we just have milligrams per hour, but we need the milliliters per hour. So this is where we're going to use our available medication concentration. This is our IV bag or med bag. You could put what's available to us. All of those are ways of describing this, okay? Whatever the pharmacy has in that bag, there's a certain amount of milliliters. This is a 250 milliliter bag, if you can visualize a little IV bag. And in that is 250 milligrams of the medication. So we know we're going to go from milligrams here. So we've got to put it on the bottom here, and we want it to be milliliters on the top. The IV medication, the available medication, can be always used as a conversion factor because it is equal to 1 IV bag. So we know here that this medication, there's 250 milligrams in a 250 milliliter bag. Milligrams over here, as I already crossed out, cancels out the milligrams down there. And now let's go back through and just check out and make sure we've got the milliliters per hour. If you look at all the units that are canceled, we're going to be left with milliliters per hour. That is perfect. And now we can go ahead and do the calculations. I'm going to erase this over here to give us some space to put our numerator and our denominator, and then we'll write our final answer below. So if you take out your calculator and you multiply across the numerator there, you're going to take 350 times 60 times 1 times 250, and you're going to get a large number. I got 5,250,000. All right. You can then divide that by the denominator. In this case, I can take the 1,000 and divide that out right away. And then I can divide again by the 250, or I can do it all at the same time. I got the final answer of 21 milliliters per hour. But I'll write up that numerator just for you guys that want to see it written out. The 350 times 60 times 1 times 250 is that 5 million. I might not have enough space, but let's see. 250,000. And there we go. And then the bottom is going to be equal to that 1,000 times 1 times 250, which gives us the 250,000. And when you do that, it simplifies to 21, which is labeled as milliliters per hour. And now let's move on to another example. This one is going to vary from the last one, but not significantly. We still have our key pieces of information, so let's go through and identify them in this equation. We are ordered to infuse fentanyl at 1 microgram per kilogram per hour. So that's that weight-based order again, right? And we know the patient weighs 80 kilograms. So those are important key pieces of information. We know later on we are going to need to identify this medication bag that's available. 100 micrograms are in a 100 milliliter bag. So imagine a 100 milliliter bag of medication, 100 micrograms of fentanyl is inside of that. But with all weight-based orders, it's easy to get turned around and be like, oh, there's so much information, there's so many steps. As I mentioned before, if you see kilograms in that order, make sure you always take care of that patient's body weight first. Give yourself a little smiley face there to remember, or a stick figure, to remember that you need to identify how many kilograms does that patient weigh. This patient weighs 80 kilograms. Then you multiply that times your order. 1 microgram per kilogram per hour. So every hour, this patient should get a microgram for every kilogram they weigh. If we take 80 times 1, we get 80, and that's going to be 80 micrograms per hour for this patient. Just to remind you, the kilograms here cancels the kilograms there. So then we know this patient's getting 80 micrograms per hour. So now that we have the order, we can kind of start with our dimensional analysis. And our order, I'm going to write it up and down in a more typical fraction way. It's 80 micrograms, and it's per hour. I would put 1 hour, but it's like every single hour they should be getting 80 micrograms until this order is discontinued. So with our order, we start there. I always like to write out milliliters per hour over here so you can see where we're going. The first thing I like to consider is that time conversion. Do we need it? We already are in hours, so we don't need it for this patient, for this order. The next one I like to consider is the units. Do the units in the order, micrograms, do those match with what's in the bag? They actually do, so we don't need a unit conversion in this case. And what was the last thing that was left? It was our IV med bag, right? We always have to use the IV medication bag because we always need to know the ratio of what's in that. So in this case, we will just multiply here by what's in that IV bag. We know micrograms is on the top here, so it's got to be on the bottom here. Micrograms is on the bottom, and then it is in milliliters on the top. This bag has 100 milliliters in it of liquid, and it's got 100 micrograms of medication in it. So when we take this and do the math, we are going to get 80 times 100, that's 8,000 divided by 100. The 100s kind of cancel, the micrograms cancel, and we're left with milliliters per hour. Our final answer is going to be 80 milliliters per hour. And that's what we're going to run our order at. So you can see here, you always need to go through the steps to check and see, okay, wait, did I check my patient's body weight? Yes. Did I check my patient's order? Yes. I got it based on their body weight. Then do they need time? Do they need units converted? And then what is my IV medication bag? And I use that. Let's move on to another example and variation. We'll always follow these same steps. All right, our next example has another variation, but it's similar in some ways also. We have our order for propofol, 2 milligrams per kilogram per hour. All right, the patient weighs 60 kilograms. The available medication is 1 gram in 100 milliliters. Now, at this point in our examples, you may be finding ways that you would prefer to do it. I know some students, they like to convert what's available right here. They would like to say, oh wait, instead of saying 1 gram, let's just make this grams match the milligrams here right now. That is possible, and that's just a fine way to do things. You just have to keep track of the order or the steps that you do so that you're not getting mixed around. The best way I feel to do that is by labeling your every number in your equation. That way you know for sure you're not missing a step. Most students that I see that are confident or in this skill but still missing questions, they aren't labeling things and they're accidentally missing them. So be careful. I do recommend the labeling. It just seems to work best for most students to not make mistakes that they are capable of not making if they just have that extra detail of the labels. But let's go back to our basics. We have our key information in this question, and the first things first that we're always going to want to look for are how many kilograms does this patient weigh? And let's get that weight-based order now based on this patient's body weight. So we always take the patient's weight in kilograms, 60 kilograms, and we're going to multiply it by our order, which was 2 milligrams per kilogram per hour. All right, as a reminder, when you multiply kilograms here, you're going to cancel out the kilograms there. You'll be left with milligrams per hour. If we do the math, 60 times 2, we are left with 120 milligrams per hour. All right, and that's our order for this patient specifically. We'll start with our order down here. And we have 120 milligrams per hour. Now, first question that we always like to ask is, do we need a time conversion? Do we? No, we're already in hours, so we do not need a time conversion. The second question, do we need a unit conversion? And we're in milligrams here, but we're in grams up here. So yes, we do. All right, let's write that out right now. We know we are going from milligrams, which was on the top up here, so we're going to put on the bottom down here, and we are getting that into grams because our IV bag is grams. We know 1 gram is equal to 1,000 milligrams. Again, remember the unit conversions. You usually need to memorize these so that you can just have them on the top of your head and you can easily put them into place. They're always the same. They're always based on 10, so 1,000 milligrams equals a gram. Make sure you have those down, and that makes you use them properly. We are not using the IV bag yet, but that is our next question. So moving on here, what's our IV med bag? What's the available medication? And you always have to do this step. You can't ever leave it out, okay? That's what's listed up here in our question. You don't have to make up what's in the IV bag. You should always look and see what is available. We know that this IV bag has 1 gram, and that is in 100 milliliters of liquid. The gram here will cancel the gram there, and we are left then, let's double check, with milliliters per hour, which is exactly what we want. So you see how the labels can kind of keep you on track to make sure that you're solving for the right thing and you're not leaving out a step. Now let's go ahead and finalize this by doing all the math. We'll have 120 times 1 times 100, which gives you 12,000. And then on the bottom, you'll have 1 times 1,000 times 1, which gives you 1,000 again. If you take this and simplify it, you get 12. And make sure you label it milliliters per hour. And that's what your IV bump should be running at for this order. And moving on to our next example, we're back to a microgram per kilogram per minute question, which is similar to the first example. Again, a variation. They all have slight variations, these orders. But if you know the steps, you can work through them all. We're supposed to infuse nitroglycerin at 0.5 micrograms per kilogram per minute. So that weight-based order, we need the patient's body weight. We also can take a look here at the concentration of the available medication. That 250 milliliter bag has 50 milligrams in it. So first things first, with a weight-based order, where do you start? You start with the patient's weight, right? 65 kilograms. And we're going to multiply that by our order, 0.5 micrograms per kilogram per minute. If you just want to cancel this out to visually give yourself what's left, you got micrograms per minute because the kilograms cancels out. All right, we're going to take the 65 and multiply it times the 0.5. And that gives us 32.5 micrograms per minute. Every minute, this patient should be getting 32.5 micrograms. All right, so now we're on to our dimensional analysis. We are starting with our order, and we will write this just like we have in our other examples, where we put the numerator and the denominator just stacked right on top of each other there. Again, I find this easier to visualize, especially when we write over here, okay, we're going to milliliters per hour. That's what we're trying to solve always. And that's what our question asked. But if you're using an IV pump, that's some of the information that you're going to need. So first things first, hopefully by now you know the steps. You need to check. Do you need a time conversion? Well, we've got minutes here and we got hours over here. So yes, we need a time conversion. And we know we can multiply by our typical conversion where we have 60 minutes and that is equal to 1 hour. Next thing that we look and check for is what? A unit conversion. Unit conversion. So do we need to go from units to different units? We have micrograms here and our bag has milligrams. So yes. So we are going to go from micrograms to milligrams. Again, micrograms is on the bottom here because it's on the top up here. We know that 1,000 micrograms is 1 milligram. You can kind of do the fill in the blank. That's what I like about this. And then our final question, hopefully you're ready for this. What haven't we used yet? We haven't used our IV medication that's available. The IV med is what's in the bag. What's the concentration in that bag? A tip for using the IV med bag, you should always put the milliliters on top. You can also check this by looking at milligrams here and knowing you milligrams on the bottom here. But the milliliters always goes on top, partly because you need to find milliliters for your final answer on the top. So make sure the IV medication bag, the milliliters is always on top if you're trying to calculate the milliliters per hour. As I mentioned before, milligrams here cancels milligrams here. And I didn't cancel out the minutes and the hours there, but let's just check to see. We got milliliters left and we got hours left. So perfect. If we do this math, we should get our correct final equation. I'll get this out of our way and we will do these calculations on the calculator. So first things first, we'll take the top. We'll take 32.5 from that order and we'll multiply it by 60. And then we'll multiply it by 1, and then we'll multiply it by 250. That gives us 487,500. And then we look at the bottom. We need to take 1,000 times 1 times 50, which gives us 50,000. And now we can simplify this by doing the math. When you do that, you get 9.75. Now, some pumps, some institutions will have you run your rate at this 100th. In other places, they do have you round to the 10th place. If you would like to learn to do that, I have a video on rounding. But if you do need to round to the 10th, you would put 9.8 because the 7 has a 5 to the right. You round up if you're rounding to the nearest 10th place, and that would be 9.8 milliliters per hour if it's rounded to the 10th place. Just check your policy or procedure depending on where you work or if you're in school to figure out what the best practice is and what the policy involves. And now for our final practice question. Here we have an order for epinephrine, 0.1 micrograms per kilogram per minute. That's our order and that weight-based order, so we need the patient's weight. Our available medication concentration is 1 milligram through 100 milliliters. So that little 100 milliliter bag has 1 milligram of epinephrine in it. We're going to calculate the rate in milliliters per hour. First thing first, with a weight-based order, you see that kilograms in there, you need to know the kilograms for your patient. We already know it's 55 kilograms. Don't forget, if you're given the weight in pounds, you can convert from pounds to kilograms. If you need to get better at that skill, I have a video to remind you on how to do that. But here we already have kilograms. We're starting with the 55 kilograms that the patient weighs, and we're multiplying it by that weight-based order. 0.1 micrograms per kilogram per minute. All right, remember when we do this math, the kilograms here cancels the kilograms here. We're left with micrograms per minute. So 55 times 0.1 is going to give us 5.5 micrograms per minute. Let's write that down here like we've been doing in the past. We have our weight-based order, but now it's specific to this patient, so the weight's out of there. We have 5.5 micrograms per minute. Our first question is what we look at first. Do we need a time conversion? And yes, we do. We need to go from minutes to hours. We know 60 minutes is equal to 1 hour. And there we go. Now our bottom's an hour. All right. The top micrograms, do we need to address that? Do we need a unit conversion? Well, we have micrograms here and we have milligrams here. So yes, they don't match. We need to make a match. We're going to go from micrograms to milligrams. We know that 1 milligram is equal to 1,000 micrograms. Micrograms will cancel. So you did it right. Make sure you don't flip this and do it in the opposite way. You'll have a totally different answer. So the micrograms is on the top here, it's on the bottom here. And that puts it in milligrams. All right, our last question that we always ask then is the IV med. What's available, right? And we know that is 1 milligram in 100 milliliters. So remember, the milliliters goes on top, 100 milliliters and 1 milligram. Milligram cancels milligrams, and we're left with milliliters. Milliliters on the top and hours on the bottom. That'll give us our correct final answer, and so we'll go ahead and do our calculations on the calculator. Our numerator has 5.5 times 60 times 1 times 100, which gives us 33,000. And then our bottom is just 1 times 1,000 times 1, so that gives us 1,000 down there. When we take 33,000 and we divide it by 1,000, we are left with 33 milliliters per hour, which is our final answer. I know these questions can seem complicated at first, but always let the order and then what the question is actually asking you for kind of be your roadmap. And if you can remember these basic steps of looking at the body weight, getting that order based on that patient's body weight, and then do I need a time conversion? Do I need a unit conversion? And what's my available IV medication? That should provide a template for you to solve these no matter what the variation on them. They do take some practice, so keep practicing. I recommend you practice with a consistent method in a consistent order. Often that helps students be the most accurate and to remember the calculations that they're doing. I wish you the best, and I hope this was helpful. Keep up the good work.